Hi, my name is Dr. Rachel Amato. I am a veterinary intern currently working here at the Raptor Center. Today I'm going to be talking about one of my patients. It is a male adult red-tailed hawk. He was found off of Highway 66 in North Dakota, and he was unable to fly. And this was about a few weeks ago that he came in. So on his admission, I noted that he was very thin, very dehydrated, weak. He felt cold to the touch. He had hypothermia, which is a low internal body temperature, and he also had some bruising on the right side of his neck. So for his physical exam, I could feel that there was kind of an unusual thickening around the bone that was going towards his wrist. And I also performed an eye exam on him, which showed a retinal tear in his left eye. On all of our intake birds, we try to get blood and radiographs or x-rays as long as they're stable. And on his x-rays, we could see a small circular opacity near his right elbow that we identified as a shotgun pellet. So this is the first view that we took for the red-tailed hawk. And as you can see, and I zoom in here, you can see the bullet that is in his elbow. You can also see what is an old fracture in his ulna bone, which is a bone in your forearm. And the reason I can tell that it's old is that it's very bright. If you look at the brightness level of this bone compared to the one next to it, the radius, you can tell it's a lot brighter. It's also kind of got this soft edges around it that indicate the bone is trying to heal itself. And I can even see some faint lines of where the fracture is filling in as well. And then on his other wing, he also had a bullet that was most likely under his skin. So his other clinical signs, him being starving, made a lot more sense because he was most likely unable to fly with that broken wing for a long time and unable to hunt for food. So his blood work also showed that he was anemic, which means that he was lacking in red blood cells, something we need to transport oxygen to our tissues. And that also fit with his history of not being able to eat for a while, as anemia can be a result of starvation. So with all of our admissions, we like to focus on the animal first, the individual animal, figure out what we can do to make them better. And our goal is ultimately to release them back into the wild. So my job is to kind of figure out the steps to make that happen. I chose to focus on his starvation first to fix that first, and I slowly introduced liquid and then solid food to help him get stronger, as most of his problems were coming from the fact that he was starving. And after building up his strength, I can focus more on his injured wing, that old fracture, which I'm treating conservatively, so not surgically. And in the meantime, he is on anti-inflammatory medications, he's on pain medications, he's also on an antibiotic and antifungal to prevent any infections. So for his conservative treatment, I placed a wing wrap, which is basically silk tape that goes all the way around their body and then also around the wing that's affected. In addition, I've been performing physical therapy on his wing about twice a week. I do that while he's under anesthesia, and I basically gradually stretch out his wing so that he can eventually extend it fully for flight. And the great thing about this patient was that he was able to contribute during his time in our hospital to 2 different research projects that we are currently working on. One involves setting parameters or reference ranges for a blood value that will help us make better clinical decisions for starvation birds. And the other one is a study focusing on antimicrobial resistance in wild and rehabilitated birds. So in wildlife, there really isn't a lot of research and knowledge, such as other fields like small animal or even human medicine. So every bird that comes into our hospital, we really use as a great teaching opportunity for us to learn more about their species and more about their population as a whole. Ultimately, we are very reliant on donations to care for these birds. Without you, none of this would be possible. Currently, this red-tailed loves food and he's gaining weight really well. He's also receiving his physical therapy twice a week and regaining extension of his wing so that he will ultimately be able to fly and be released into the wild.